Okay, we are live.
Hello, everyone. Welcome back to Fresh Dental Shadowing. Today we have Dr. Irena Mota for our virtual session. So she will start the session now.
All right. Hi, everybody. Welcome. Happy to present some insight into dentistry for you guys, since it's time where you cannot really go into the office and observe things. I try to keep it as an overall picture for dentistry, just to show you some cases and talk about my journey. Just depends on where you guys are at with your studying or thinking about going into dentistry. And then I have some time for questions later on. So, sorry. So I have to go play. Great. Now I see this screen right here. How do I lower this? I don't have a mouse anymore. Can you guys see okay? Do you see the screen on the side? Is it blocking my presentation or no? Okay, well, we'll just go with it. Okay, so my name is Dr. Irena Mota. I'm a general dentist. I practice out of Vancouver, British Columbia. I work in two different offices, one in West Vancouver and one in Vancouver main area. Just a quick outline. So we're going to talk about dentistry, why I chose dentistry. We're going to talk about options in dentistry or post-grad. Also talk about a little bit about pros and cons and some daily challenges. I'll show you some cases where I've changed some smiles and changed some lives. So let's get started. This is a picture of me. This is UBC. I went to UBC and they give you this card when you go to the interview. And so I kept that card and I put a doctor in front of it because I knew I was going to be a doctor. So most of you probably picturing dentistry is like a super long road. It is a very long study time. You have to do the undergrad and then you have to do the 4 years of dental school. And then some people choose to go to practice some specialty, which is another 3 to 5 or more. So it sounds like a long road, and it was a pretty long road for me because I went kind of a different route. I actually became an assistant first, and then I was a dental hygienist for about 12 years. And then I went back to dentistry to become a doctor of dental medicine from faculty of UBC, Faculty of Dentistry. And there's a picture of my children. So I did it actually later on in my 30s, where I went back to become a doctor. So this is a laughing picture of me and my kids because I feel like I'm in grade 95 and this is a couple of years ago. So anyways, I finished this survey dental assisting and the dental hygiene program at the same school. So, and you can see the assisting program was 10 months. The registered dental hygiene program was 2 years full time, but you also have to have prerequisites for 1 year, and the UBC was 4 years. But it was a really, I kind of completed all that within 15 years. So because life happened. So why dentistry? This is a picture of my parents on the more towards the left. That's my dad and my mom. So I'm originally from Ukraine. I was born in Ukraine, and then we came to Canada in 1998 when I was 16 with my identical twin sister, who was not in dentistry and not in medicine. And my family had two options to kind of choose from. So my dad was a cardiac surgeon and my mom was an ophthalmologist. And those are the two options that you have in Ukraine to follow in the footsteps of your parents. So I actually wanted to be like my dad. I wanted to be a cardiac surgeon. And I was in the OR since I was 10, 11, observing him doing transplants and bypasses and everything. Had the privilege of going to that as a daughter, but I just was observing, and I really liked. I just loved surgery. So, however, what I didn't like was, the pain that was after the surgery, the sleep deprivation for the surgeon, because the surgeries that you were doing for cardiology are 16 to 18 hours. So, and then you have to stay after to make sure the person's okay. Definitely deaths. People die on the table, so that's not really great. So cardiology was my main kind of topic when I came to Canada. But then I I changed my mind because those were kind of like the cons of going into medicine and doing what my dad's doing. And we didn't have the best dental care in Ukraine when we came here. So we had to spend like a year at the dental office trying to fix all our cavities. And that person that was my mentor, because I walked into there, was being scared. I thought she was going to hurt me. I had a pain in my mouth, and it's been there for like months. And it was a nice office. The person dressed nicely. I didn't smell like burned blood. Nobody was screaming. Nobody was dying. The person worked 9 to 5, and they provided quality care in a timely manner, but also seemed like they could go home at 5 o'clock and not worry about what's going to happen with the patient. Like, am I going to get called? And so really dentistry offered flexibility. It offered quality of care that you can control. Because one of the things about medicine is that there's so many moving parts. Like sometimes you're not really in charge of the outcome. You try to help the person, but there's so many other things that are happening at the same time. Dentistry is a bit more focused. So that kind of what drew me to dentistry, but also my mentor, like she made it the best experience for me. And I was like, wow, I want to do that for people. So that's why I chose dentistry. But I took a long road. So she did recommend, she said, you know what, dentistry specific, by the time you go to dental school, you haven't been in the mouth. It's like you've already studied for so many years, and it's tough. Sometimes you get there and you're like, I don't want to do this. So she's the one who recommended I do like a stepwise approach, either do the dental hygiene program or dental assisting program, just to really see whether I even like it, without spending 10 years in school and then knowing that I don't like it. So that's what I chose for me. And I do think that for some people, it's a good experience. Like if you just do one of the programs, get the experience, work in an office for a little bit, and then really know whether you want to proceed or not. So for me, I did that. Life happened. These are my two kids. So my son's only 16 and my daughter's almost 13. This is when they were very little. And so I went to UBC in 2016 and 2020. So I was there for 4 years. And it was a challenging 4 years. I'm not going to lie. One of the reasons I think is because I went to school later on in life, and I have a really high expectation. So, and when you pay for your education, when you really see the bills for your education, you really want people to teach you things. And the delivery of education is still kind of the same as it was 40 years ago. It's very based on, everybody has to do the same thing. Everybody learns the same way. So it was tough because not everybody learns the same way. Like we had to attend lectures. They would give us trouble if we didn't show up for a lecture, even though it was online, like we could look it up. They were like, no, you still have to show up. So one of the things that I really think was really good at school is making sure that you are, there's just some pictures of me, but just really keeping in mind that this is a service industry. Like the patient's there, they're paying money for this service, and it's in your interest to make sure that they get the good service, but also you're educating them. And lots of people say, like, what do I do? How do I get in? What do I do? How do I do the interview? Like, what do I say? I think really it's important to remember that if you have any kind of other work experience, it really helps you, especially in customer service. Because at the end of the day, that's still a customer sitting in front of you saying, oh, I need to get this fixed, paying their money for this service. And then if they're not happy, you have to know how to deal with that. You have to know how to deal with human emotions. You have to know how to explain things, how to listen. And that's all taught outside of dentistry. Like you can't really learn that in dental school. Dental school is about learning how to fix teeth and learning all the things about teeth. It's not about how do you talk to the patient? How do you make them feel comfortable? How do you approach the subject of difficult topics? How do you manage stress? How do you manage anxiety? Those are all the things that you learn outside of dental school. So if you can do that before you get into school, if you can search opportunities and things that you can learn from other people, I think that's the most valuable kind of thing that I can give you advice or trick to how to be a better candidate for the dental school. Because, everybody, that's just part of my cohort. Everybody was smart. Everybody had great marks, but not everybody had great communication skills. Like not everybody knew how to talk to the patient, and everybody knew how to translate the information to the instructor. So those all things come with experience. But if you are just doing school and you're focusing so much on just getting an A and not focusing on other things in your life, which again involve you and make you grow. I think that's the big trick or tip. All right, what else is here? There's just some more pictures of me working on the dentiform. And then in the second year in dental school, I don't know if you know, maybe you have friends, they do a white coat ceremony, at least at UVC. So they give you a white coat before you actually start seeing patients in clinic. It was a challenging 4 years, but it is a technical skill. I think if you spend long time enough time, you will get it. It just, some people, everybody's at their own pace. Some people had to take longer, and some people took not as long to learn all the things that you need to learn how to do it in the mouth with all the little things that you have to hold. So as I said, other work experience is a must. So I worked as a dental hygienist for 12 years before I went into dentistry. I worked throughout the school as well. So I think I was the only person working. We had school Monday to Friday, and I worked Saturday. So again, interesting implementing your knowledge that you've learned at school already into work while you're at school. But that's just me in my office. And the other thing that you do is you make connections, and and it doesn't have to be dentistry. This is what I did. But if you choose to do other jobs while you're in dental school or while you're preparing for dentistry, you make connections, you grow as a person, and those are all important things for you as a human being. Because at the end, if you do all this stuff and you choose not to be a dentist, or you choose not to go to dentistry, those things will still stick with you, and they will help you in other careers. And you make friends for life too. You can meet some great people by doing some other things. These are some of my friends that I used to work with, and I still work with Samantha here. So how after I graduated, I joined Bromar Dentistry. That's my West Vancouver office. I work there about 3 days a week. And the other thing, what I was going to say is, if you work at other places, or even go shadow or help in the dental offices, you learn, you meet like individuals, like people who think like you and who want to deliver the same care as you. And so that creates opportunities later on in life where you could possibly, join their practice, or learn from them, or they can be a mentor. So I was lucky enough to meet Ali, the guy next to me. He's the practice owner, so I'm the associate. I don't own the practice. We have him, he's the owner, and there's me and the other 3 guys, and the rest is support staff, so dental hygiene, receptionists, certified dental assistants. But I met him at a dental, not a convention, it was like a lecture. And we are very similar in how we provide care. We're both outgoing. We want to make sure we do the best care for the patient. And so I actually joined his practice in my second year of dental school. I was a hygienist for him for 3 years. And then when I graduated in 2020, I joined his office as a doctor. So that was my experience, and I think it's very valuable for you just to keep your eyes open, meet new people and stuff. It's really important for the future. You never know what's going to happen. So I got lucky. Here's Dr. K. He's one of the doctors in our office. He's the oldest dentist. He's 68, and he still loves what he does. He's still working. There's me. We have a wall with our pictures on there, so we're all laughing. And then the other one, we're just holding some old X-rays. So as you guys might know, technology is changing quite fast in medicine and dentistry. So we no longer have to take X-rays that are like on a film. Usually they're digital X-rays now. And so my next, suggestion is, if you love what you do, you'll do it well. This is on the left side, me and my assistant. We have, this is our little corridor where we sterilize instruments, but we have a great time at work, and we love what we do, and that translates into our work. And the patients can see that as well. So I really like working with children and youth because I feel like that's where you can make the most impact. Because you can still change people's behaviors or encourage behavior change, so people can keep their teeth for life. Can we fix teeth? Yes. Can we take teeth out and put implants? Yes. But it's so much nicer for you to keep your teeth and keep them as healthy as you can. And You might not know this, but you get your adult teeth. All of your adult teeth are usually in by the time you're maybe 12, 13. I don't know who remembers when they were 12, 13, if brushing was really important to you. It probably wasn't. It wasn't one of those things that people talk to you about, like, should you brush your teeth? Maybe now, but you don't really pay attention in your teens of how impactful it is for you to keep your teeth clean, to go to the dentist, to have checkups. Sometimes that kind of goes to the back seat. So I like seeing children in my practice. So because I feel like that makes the most impact. As I said, fixing damage, for sure, we can do that. I also call it renewal dentistry. Some people call it reconstruction. So I have a few cases that I've done where it's kind of a smile makeover, and I'll show you a case in a little bit. And then projects. So, participating in things like this or Future DMD. I don't know if you know about that project that my friend started, Dr. Bruce Chow, just helping people with just pre-dents, people who considering dentistry, just educating them about the dental field and when they're considering things, because, we'll tell you things that people don't want to tell you. So, and then the daily schedule. So, I see all kinds of people, and I see, teenagers. I see kids that are 1-year-olds. I see, I just had a 92-year-old in the chair yesterday. I see all kinds of people. However, as a general dentist, you can choose to do certain things. You can choose to only do reconstruction cases, so you can choose only to do implants, or you can choose to do, specific things that you're really good at, like gum surgery. So the reason why I didn't specialize is because in general practice, you can kind of specialize in your own way. You can do courses that teach you more things about implants or surgeries, and get better at those things, and really focus your practice on that one thing, but not go to school for another 3 or 4 years. So that's the benefit. So this is, when I do see children, we always talk about diagnosis and treatment planning. So, when we see kids, it's usually called the lap to lap exam. So you'll see a photo here. There's mom, holding the child and then brushing his teeth. Usually we see people, hopefully we'll see the kid before the age of 1, not because we want to brush his teeth and stuff. It's more for education of the parent, because the parent is in charge of the brushing. The parent's in charge of what the person's eating. The parent's in charge of how often they're eating. But some of the things, we do, it's called show, tell, do. So we always showing the child what it is. We're telling what we're doing. So really trying to make sure that the child knows that they're safe and their parents are in the room. We take photos, we put it up there, and so that they really like it. And we talk about, oral hygiene. We talk about diet. We educate the parents. And then we also diagnose cavities at that time, because you'd be surprised. A lot of kids do have cavities and the parents don't even know it. So this is kind of in detail, but I didn't know if you guys wanted just to know the cavities have different stages. We don't always fix them. There's incipient decay, which means that the cavity is just starting and we don't have to fix it yet, and you can reverse it. And some of you might have heard that in your dental office, like, oh, there's a small cavity starting, we're going to watch it. So that just means if you keep it clean, if you use extra fluoride toothpaste or extra fluoride mouthwash, you can reverse the cavity, you can remineralize the tooth, and that's the best kind of cavity. And in children, we usually have that. And that's why it's important for the kids to come every 6 months, because we can alter things for them, and they can keep their teeth healthy. The cavity decay it's not close to the nerve, but it needs a filling. So that means that it's already pretty big and we have to fix it. And then deep cavity is sometimes for kids, we have to do like a mini root canal where because the cavity is really close to the nerve, we have to clean out the inside of the tooth and seal it up. And also there's very deep cavities or infections where sometimes you have to take teeth out for kids because we can't save the tooth. And then we consider what's called a space maintenance, because if the tooth comes out sooner than it has to, then we have to maintain a space for the adult tooth to come in. If we don't maintain a space and we take the tooth out, then the teeth next to it are going to start collapsing onto the space. So it sounds like kids are so easy. You just come in, brush their teeth, but it's actually really important to pay attention to many things when you're seeing children. So, but I love it. So I love seeing kids. So that's my kind of my little niche. I always laugh. I'm like, I'm running my own pediatric practice in my private practice. So this is just a photo of a child. This is not my photo, but very often in communities who don't have access to care, don't have access to education, we'll see things like that, just broken down teeth. This is called early severe childhood caries, where this child is about 3 years old, but there's lots of decay and lots of infections. So we don't want to see this. Is what we don't want to see. That's why the first part is really important. And this is just an overview slide. This is my first patient in my second year, I believe, my first pedo patient, and she was so good. Like in school, you guys, you have 3 hours to do the procedure. And that's compared to private practice where you have, 40 minutes or an hour, but you do have an assistant. In school, you don't have an assistant. You do everything by yourself. You're the assistant, you're the reception, you're everything. But this kid was really good. She did so well. And I was like, can I take a picture for you for my kids? They're going to be so excited to know that I worked on you and you were happy. This is at the end of the procedures. That's not even at the beginning. So we always make sure that the child knows what they're in control. Because kids want to know, make sure that they know what's going on. So always talking to them, always having a conversation with the parents, using child-friendly language, laughing and encourage, and always doing the high fives at the end. It does take a lot of energy to see children. There's a lot of talking. With some adults, they just put the headphones in and they just watch TV and you don't have to talk to them. But for kids, you have to make sure that they're comfortable. Just some more photos of me in my office. We on the right side over here, I'm just doing some surgery for this patient. And, people sometimes they like to stand. I actually don't like sitting too long. So I remember when I was in dental school, instructors would be like, "Are you okay? Why are you standing?" Because we would have to sit for lectures for so long. And I was like, I can't sit anymore. I just want to stand for attendance. So, and we all know sitting's bad for us. So, anyways, this is just me and my assistant working. And so just a couple of points about typical day at the office. So this is how we run our practice, and every dentist has an assistant, and it's a little bit different for everybody, but we do all have mom meetings in the morning, and I love that name. So it's morning opportunity meetings where, let's say on Thursday, there's me and Dr. Bernard who are working together, and there's 3 or 4 hygienists. We have a consult room, we go in the room and we have a mom meeting. So we all go over each other's days. We talk about which patients we're seeing, not so much what we're doing per se, but just talking about, just so we know what everybody's doing. Like if there's a person that's coming in my chair and they're really anxious, or there's a child who's going to be crying, or they have pain, it's important that everybody else knows that's happening, because then everybody else can kind of prepare their patients. We can kind of shuffle people around, or just so everybody knows. It's super important to have that meeting in the morning. And my CDA, the certified dental assistants, make sticky notes. So I always call it's like surgery. So, we are doing surgery in the mouth. Like we're prepping the tooth, we're touching the tooth with fur. It's super important to have checks and triple checks and quadruple checks to make sure you're doing the same thing as you treatment plan, especially in the big offices where you have more than one dentist. Sometimes I see the patient and I don't have time to see this patient. I need to refer him to Dr. Bernard because he has space tomorrow. I have to make sure that I write down what I think needs to be done. And that's his job to check, make sure that he agrees with me and he does what needs to be done. So he'll check the treatment plan. Then the CDA writes the sticky note. And then before we touched it, before we even freeze the patient, we all triple check to make sure we're doing the right tooth in the right quadrant, and the right patient. So those are really important. Those are the things that we need to check. And some of the procedures we do are fillings. It's usually about an hour and a half, really depends on how many fillings. Root canals or root canal therapies, those take a little bit longer because they're longer procedures. I do everything: extractions, crown preps, gum surgeries. I do everything. So and by I do everything, definitely case selection. So there's a case is a bit more challenging, I will refer to the specialist. And there's different specialists. I don't know if you guys know. So there's endodontists who are specialists for the root canal therapies and infections. There's periodontists who are gum specialists. There are prosthodontists who are specialists in reconstruction of the mouth with like crowns and things. There's oral surgery specialist who is more of that's the longest, I think, school that you ever have to do, because they're almost like an MD and DMD. They do wisdom teeth extractions, implants, jaw reconstructions, all of those things. Those are the high-end educated doctors. And the other thing that we always have to keep in mind during the day is that, sure, you have your own chair and you have other people around you, but you also have to go into do checkups for your hygienist. So you really have to stay on top of your time because you might have to leave in the middle of the procedure to do an exam for your hygienist. So, and the other bottom part there in this 3 stars is always end of the day check in with your assistant. What went well, what didn't go well, what can we do differently next time? Always checking in with your person. So your assistant is like your husband or wife or your boyfriend or girlfriend. You're spending 8 hours with them, and it's important that you have good communication. You cannot, you'll always, there's going to be times where you have hard days. There's going to be times where you're tired, where you're exhausted. This patient took a lot of energy out of you, and we can take it out on our assistant. And it's important to talk about it. Like, I'm sorry, I was really, short with you or whatever. It is a relationship that you have to maintain, just like any other relationship in your life. So, though we always do a day-end check-in. So this is some of the cases that I'm going to show you. I hope it's not too complicated. I'll have some, if you guys have questions after, I'm happy to answer, but I just wanted to show you some of the things that I've done so far in my practice. And, people always dread about the root canal therapies. And root canal therapy, all it is just a longer filling procedure. So instead of filling just the side or the top of the tooth, we fill everything in the tooth. We take all the tissue out and fill it up. So, but people always have bad stories to talk about root canals, and there's this outstanding fear about root canal therapies. But always remember that dentistry medicine is changing like by minute. So things that we've done 10 years ago are things we don't do anymore, or we do them better. There's better products, there's better anesthetics, there's better detecting things that we can use. So, people always dread the root canals, but after it's done, they're like, oh, it wasn't as bad. It was just long. And they get to watch TV all for 2 hours. So here's a patient that I just saw recently. He moved here from Turkey, and the tooth on the lower left where the arrows point, lower left on the screen, but actually on the right side in his mouth. Because when you look at this X-ray, it's called a Panoramic X-Ray. That shows us a lot, kind of an overview. This is you looking at the patient. So where the tooth is actually is on the right side. So you can probably see there's like something kind of white and then a darkness underneath. So that's he had a really big cavity on that side. And he actually has one on the other side. I don't know if you guys can see. Has no filling, but that darkness around the tooth, that's a cavity. The little skinny part in the middle, that's the nerve of the tooth. And every time the cavity gets really close to the nerve, it's microscopically, there's definitely inflammation already happening in this tooth. The tooth on the left side here with the arrow. So a recommendation was made. You need a root canal therapy on this tooth. We need to build up the tooth and put a crown on it, because after the root canal is done, the tooth is really fragile. So usually, especially in the back teeth, you need crowns, and the crown is like a cap that caps the tooth to protect the tooth from breaking. So, so this is a pre-op. This is a closer photo here again. Now you can see the little red marks. So because we use digital X-rays, we can also measure things on the screen. So this is about 18 millimeters. So that's important for when we're doing root canals, how far we go, which instruments we use, things like that. So, and the X-ray on the right side, right screen is the after. So it is challenging to take an X-ray on the side. So I think this is the best one we got with my assistant. It might have been a better one, but that's the one I got. So you can kind of see that the tooth has been filled, and the cavity was removed, and it's right now prepped for a crown. So I don't have an intraoral photo, I'm sorry. This is another case, kind of different, but I've seen this patient. This is a tooth on the upper left, tooth with a star. It's a first molar, and you can kind of see a little bit quite white on the chewing surface, but it's really close to the darkness spot. So again, the nerve is just the one in the middle, right? That goes into the root. So it was that tooth. That filling has been there for a while, but the tooth just kept aching her. She just kept delaying, and finally she said, "Okay, let's just get the root canal done, because I just can't bite on this tooth anymore." So when the nerve is inflamed, your tooth will kind of ache. You'll have some cold and hot sensitivity. So and everybody's different. Some people won't have that. Some people will just be like, oh, it kind of feels weird sometimes. We don't have an infection there. So, and how we get rid of infection is we open up the tooth, and this is an intraoral photo. So inside, you can kind of see the little black holes. So that's when I've removed the filling, or most of the filling in the middle, and then got access to the canals of the nerve. And then we just use different instruments. There's hand files, there's rotary instruments to clean the tooth on the inside and make sure it's nice and clean before we just fill it up. So we use a different material to fill up the tooth. And the reason why root canals take so long is because there's many steps, there's many checkpoints that you have to do when you do a root canal therapy. So the upper left film here, X-ray, this is called a trial file. So where we've got access to all the canals, and then we have to take a film to make sure that the little file is the right length. I don't want to bore you too much about this, but so it's super important to take these specific X-rays at specific times of the root canal procedure. So the lower right film is another check-in. So this is when we actually do the filling. So you kind of see them, the little things sticking out. They're actually like a little files, but they're soft material. And they go in a heater. So when we just place them in, it'll just look like a cone. It's called gutta percha. And so you can kind of see that this tooth has 4 canals because there's 4 different cones that we're placing into the tooth. And again, this is just to check, make sure everything's in the right spot. This is one of the most difficult teeth to do in the mouth, the root canal, because this is most challenging. So this was a good case. This is the end result here. So after, this is the last X-ray you have to take. So after everything's been filled, you do a couple more steps, and then you kind of see the tooth is hollow. So we take this X-ray to make sure everything's good. And then after this X-ray is done, we fill up the tooth. And then sometimes we wait a little bit before doing a crown. Sometimes we do the crown at the same time. So like the last patient, I did the crown at the same time. This patient wanted to wait another month or 2 just to make sure the tooth is settled before doing a crown. Daily life of fillings. I always say fillings are really common. Now we do use fillings to fix the teeth with cavities, but we also use fillings to make an impact on the patient's smile. So we can add things to patient's smile if they don't like something. So they're not necessarily only for cavities. And this is a case that I did just recently. This is a girl, I think she was like 14, and this is where individualized care comes in. So this patient comes in, look at her teeth, they're beautiful. I wouldn't change anything, but she doesn't like her laterals or her second tooth from the center on the top. And as you can see, she finished braces, but her laterals are kind of smaller. And there's a space on the back of that between that tooth and the canine. So again, the arrows are pointing to it. And she didn't like it. She's like, I don't like it. It looks bad. I want the tooth to be more wide. And so this is where, again, we become an artist. We have to make sure that we can create something for the patient they like. The good thing is for this, we're just adding on some filling on the tooth. So we're not really removing any tooth structure. I usually call this as, when you get a fake fingernail. So we just buff the tooth up a little bit, and then we bond or we glue the filling on top and create the shape that the patient likes. So this is after. Again, to me, this looks good. So we just enlarged the teeth a little bit. She liked the result. The gum is a bit inflamed on the right side of the patient, but just because we have to smooth everything, and she loved the results, so she was really happy. So this is a before and after. Again, for people who don't look directly in the mouth with the microscope, potentially we're like, oh, it looks exactly the same, but she was really happy. She was like, wow, it looks way better. My teeth look more even. So some of the things we can do in the office, that doesn't take a very long time to do either. So she was really happy. And of course, creating big cases. I always call it big cases are fun. They're just super fun. So I'm going to show you a case that I just finished, I think a couple months ago. This was my friend. Her name was Heather. And she's my sister's friend. And she's had anxiety. She has phobia of the dentist. She's had phobia of the dentist all her life. She's 42. The first time I saw her was in 2018. I think I was still in dental school, and but I was a hygienist, and she was like, I haven't seen a dentist in so long, and I can't, I don't trust anybody. I need to be sedated for a cleaning. And it took me a while to convince her to come and see me. I'm like, Heather, you know me, like we'll just take it one step at a time. So slowly and surely she came in for a cleaning. I had to sedate her for a cleaning. Like she couldn't handle being in the office. Like she had anxiety coming into the office. So we did the cleaning a couple of times. We took x-rays. She started to trust me a little bit more. She just didn't want to be in pain. And she just felt like people would always ignore her pain or not pay attention to her pain. It's not so much with freezing where people don't like needles. She's like, I just don't want to be in pain. I was like, I'll make sure you're not in pain. So she wanted, and she didn't like, besides having a cleaning and making sure her mouth is healthy, she wanted to fix her teeth. She doesn't like to smile. She didn't like to smile. She had an accident. I think when she was a kid, she fell on her face. So one of the teeth, it was a little darker. Her teeth were misaligned. Her old dentist, when she was like 10, took out one of her teeth on the upper left to make more space, which didn't make any sense. And again, I wasn't there. I don't know what happened, but she was missing a tooth on the side, on the left side. When she smiles, you could see there was a big hole there. Malocclusion, it just means her teeth are misaligned. She had an uneven smile, and she just really didn't like the shape of the teeth. And so on the right side of the screen, you can kind of see the definition of the dentist. We're doctors, we're engineers, we talk about nutrition, we're therapists for some people. They come in and they just want to talk to somebody about their problem. So we're an investigator, we are scientists, and we are a teacher. So our role is not fix the teeth and let the patient go. So it is an involved profession. And if you love what you do, those are all the things that are entailed in your day. You're not just drilling and filling teeth. Those are all the things you're doing all the time. Your brain is just constantly going. So, diagnosis. So, we always talk about changes. So what do you like to change? What don't you like about your teeth, with big cases? And it's really important to set the expectation, because people, I'm sure, somebody was telling me yesterday that 19-year-olds are going to the plastic surgeon with the filters and going, I want to look like this. So in the digital world, the expectations are amazing. And so you have to make sure the expectation of the patient is realistic. Yes, we can do miracles, but we can't do everything. And it really depends on the supporting structure. So like the tooth is broken and they want to have this amazing something, and physically and physiologically, it's not going to stay there. You have to tell the patient, you're like, listen, I know you want this, but this is unrealistic and these are the reasons. So really explaining and talking to the patient, having a consultation before doing anything in the mouth is really important. On the left side, just me and assistant just working on the patient here. And we have a digital, everything in our office, like digital chart, digital x-ray. So it's really nice to work with. We have a camera that we take pictures of. So this is Heather. This is the before photo. This is, I believe this is a couple of years ago, like 2018, 2019. So you can see that, the color, and this is before she had a cleaning. I think this is the first time she came to my office. So you can kind of see the yellow between the lower teeth. You can see that the upper left first tooth, the first front tooth is more darker. It's darker than the other teeth. So that's the one that had a root canal done. And some teeth change colors as the root canal is done, because there's no more, the tooth isn't vital anymore. And so it does change color sometimes, not all the time, but sometimes it does. And so the biggest concern for people with the root canals in the front is my teeth are darker, one tooth is darker. And the only way how you can mask that is to do a cap or a crown for the tooth to kind of block out that darkness. So this is an x-ray of her mouth. So she actually has a pretty nice teeth. Like she doesn't have a lot of fillings. She's missing a couple of teeth, as I said, on the upper. Again, you're looking at the person, right? So on the upper right here on this x-ray, but it's actually the reverse. So she's missing a tooth on the left side and she's missing a tooth on the right side. Now, when we talked about addressing issues, the upper left was her main concern. The upper left missing tooth and the front tooth being dark and all the teeth being not really aligned. Those were her major concern. She is concerned about the lower right space, but that was on a back burner. I'm like, Heather, let's just address the first part. We can always do something on the bottom, but let's do the front teeth first. And so this is what I was talking about. Preparation is the key. And and things don't always go according to plan. So you just have to make sure that the patient knows that, there's a picture and then there's what happens. So a plan is what we do for big cases. It's called a wax up, where we take impressions, or we actually do a scan now, because this is the new technology. So we no longer put the gooey stuff in your mouth. We do a scan of the teeth, and then we send that to the lab, and they do what's called a wax up. So they literally wax up the teeth. They make them the shape that you think you want. And then we talk to the patient about it. So this is the Iterator 3D scanner that we use in the office. So we scan the teeth. It's all digital. It takes about 3 minutes to scan the tooth, or to scan both arches and the bite. And then that automatically gets sent to the lab with notes, and then they will make what's called a wax up. I just wanted to insert this. This is not Heather. This is somebody else, but this is another photo of what the scan looks like and what we can see now that we couldn't see before if we just look in the mouth. So you can kind of see the left and right side of the patient, and on the right side of the screen, you'll see the top arch and the lower arch, and you'll see different colors. So what the different colors indicate is, where is the patient biting heavily? So the red mark, we shouldn't really have any red marks in the front, because your front teeth shouldn't really touch. They shouldn't really touch, because that's not where the forces are. Usually the forces should be on the back teeth. So you can see this person has a very interesting bite. She has an edge to edge bite. She has an open bite in the back, like her teeth are not touching if you look at the lower left. But she's touching on the very back molars. So those molars are very, they take a lot of force. And so sometimes people break their teeth. When they come in, like, you know what, I chipped the tooth. This is the reason why, because her bite isn't balanced. When you look at the bite, when you look at the colors, you don't see blue everywhere. You don't see green everywhere. It should be pretty balanced. So when I explain to the patient is like, if you're driving a car, you don't want to be driving a car with tire pressure all different, right? You want to have tire pressure evenly. So your mouth is the same. And so that's where the intervention comes in. What can we do? We now know this person is the bite is not as great as it should be. So we can then have a conversation about it. This is the wax up that I was talking about. So on the left of the screen, you see the pre-wax up. So that's basically a 3D scan. And then they printed it as a 3D print of her mouth, right? When she bites together. And on the right side, it's called a wax up. So you can see what they did is they made the teeth look nicer. They made them a little bit bigger. But that's what me and Heather talk about. Like, okay, this is what the wax up looks like. Do you like it? Would you change anything? Do you want to make them longer? Do you want to make them shorter? So you have that conversation with the patient. This is the op day. So we are choosing shades. So sometimes we send the patient for custom shades, where they go to the lab where the crowns are made. And again, crowns are caps. So where we prep the tooth, we make them a little bit shorter, a little bit smaller, and then the cap is made in the lab, and then it goes over top of the tooth, and it's like a new tooth. So we get to choose a shade. So on the upper left, it's the before shade, and then the lower right is the shade that I think we chose for her. So it actually looks darker here when you look at the final results. They look better. The second shade we take is after the teeth are prepped. It's called the Stump Shade. So that's for the lab to know how translucent to make the teeth. Because if that tooth is dark and they make a crown that's translucent, which means the light goes through it, the tooth will still be darker. So those are the important things. It might be too much information for you guys, but there's a lot of steps when you do this procedure to make sure you're doing everything correctly and the patient's happy. So temporaries. So after the teeth are prepped, we are in temporaries. So these are, remember we did the wax up. So then now this is, I make a temporary. So there's a little mold that they give me. I put the material in and then make the temporaries in the mouth. So these are basically like a try on. They stay in the mouth. I think I left her with the temporaries for about 3 weeks. They're cemented in, you can eat and drink. You just can't floss in between because it's all one piece. But this is the after. So it looks pretty good. This is a photo of her after. She's a little bit frozen, so her lip is a little bit lower as well. But this is the temporaries. So I think it looks pretty good. She was really happy with it. I have a video that I was going to show you. I hope we have time. Let's see if I can I go sideways? Oh no. I don't know if I can go. I don't think I can go sideways. Anyways, we'll just skip the video. This is the temporaries. And so this is what the lab made for Heather. Again, this is 3D printed, but you can kind of see the crowns. So a really nice shade. really nice shape. This is just me taking a photo of it. And this is the crowns in the mouth. So they're not cemented yet. So we take the temporaries off and then we put the crowns in, and then we look like, do we like it? Do we like the shape? How's the floss? So there's a lot, again, checking, make sure the person's happy with it, make sure we're happy with it, you know, and the gums are a little bit pushed up because the temporaries push the gums up a little bit. So the gums will come down eventually. But yeah, I thought this was a good result. We did from the premolar to the premolar. We didn't touch the bottom teeth. And this is the after. So again, this is right after we cemented them in. She was really happy. The gums will move down a little bit. There's a bit of space between the front teeth. But as I said, the gums are, because we have to floss and clean the cement after when we glue the crowns in. And as you can see, there's no more space on the upper left. There's the photos. So this is the before. This is a couple of years ago. This is her in Temporaries, and this is her after. So she was really happy with the results. She felt like it was definitely changer. She was crying. That's what I was going to show you in the video. She was crying with the temporary. She was like, oh my God, she was really happy with it. She said that she could smile for the first time without being embarrassed. So, you know, those are the things that we look forward to. Those are the things that we can change as doctors for the patient. You know, you change the life. Like she smiles all the time now. She used to cover her mouth. It's a great result, and she was really happy with it. This is her after. We're taking photos. She is super happy. And then on the right side is my assistant. We're almost done. So, you know, I just wanted to show, you know, we're still patients. I wanted to try Zoom a couple of weeks ago. So my assistant did Zoom on me. It was very interesting. You know, I don't really like whitening my teeth, but it was an interesting experience. You just get really light teeth in like 2 hours. So, and this is just some like the guys that I work with. So Dr. Bamar, Dr. Sharon, Dr. Joyce. Dr. K is missing, the 16-year-old, but I think this is our Whistler trip. So, you know, dentistry is definitely a small profession. You do it's a small field, you know, everybody, and you do kind of, it is a family. So we hang out together. So it's important to find your people, as I said, like-minded individuals, the people that you get along with, that you hang out with, that you can chat to. So I'm lucky enough to work with, you know, 4 great guys. And all dentistry aside, I really love this quote. I have it on my board. It says, you will be too much for some people. You'll be too loud, too soft, too this, too that. But you'll always be perfect for the people that you love. So keep that in mind as you're going through life, because, you know, you might even in your job opportunities, you might go to jobs and people will say you're too this, too that, you know, that just means it's not your place. You know, you just haven't found your tribe. So just really keep that in mind. You're an individual. You don't have to conform to anybody. Yes, you have to grow and, you know, compromise and things like that. But really, you know, for the people, when you hang out with them, they love you for who you are, and they love all your quirks and stuff. So this is something that I always say to my kids and people around me. All right. I don't know if I made it under an hour, but if there's any questions, I will be able to answer. Sorry if I was speaking too fast, but I think this was it. This is just a social media. Not a social media person. I just have Instagram. Don't have Facebook or anything else. So you guys can follow me on there. But I think this was it. So good luck, everybody. I hope you enjoyed this presentation. If you have any more questions, I'm happy to answer them. And just have fun. This is me and my doctors I think this was Halloween last year. We all wore Mickey Mouse ears walking around the office. So as long as you have fun with what you're doing, you'll have a good time.
Thank you so much. We can just take like a few of the questions. So how do you maintain a work-life balance with being a dentist and a full-time mother?
Such a good question. I try to, I work only 3 days a week. Like, this is the other positive thing about dentistry. And even when I was a hygienist, I was able to work 3 days a week. So if you can kind of manage your time wisely and work around your schedule, I think it's important to do. I know a lot of people who graduated from dental school work 7 days a week. I told them for 4 years, my whole entire class, I'm like, do not work 7 days a week. You're 25 years old. You'll pay off your debt. It's not about your debt. It's about enjoying your life as you're working. So like, am I in debt? Yes, I'm in debt for my school. Dental school is really expensive. I don't know if any of you looked it up, but you're going to like at least $500,000 in debt for going to dental school. If you consider everything from undergrad to dental school, I think the prices are increasing as well. Dental school in the UBC was, I think, $56,000 a year times 4. So after you graduate, you're already in debt for like $300,000. That's really stressful. However, it's good debt. You'll pay it off eventually. So don't focus so much on, oh my God, I have to work so hard. I have to pay off my debt. You'll pay it off eventually. Make sure you actually enjoy your life. So really allocating time to doing the important things and looking at a big picture. So a lot of people at school, I was working when I was in dental school. So a lot of people at school would just focus so much on studying and getting an A in dentistry, which really actually doesn't matter in most schools. Like once you're in, you just want to make sure you know what you're doing in clinic. It doesn't matter that you got an A in GI tract block. It's important that you know what you're doing with a patient. But do you need to know what enzyme breaks down fat? If you got 75% on your exam, it's okay. So really just focusing on like, what do I need to know at the end of the day? And then maintaining the balance. So like I spend like 17 hours studying before the board exam. Everybody was studying. I was at the conference. Everybody's like, what are you doing? I was like, I'm done studying. I don't study. I study the week before and then I have time off. Like my brain needs to rest. So really just focusing on what works for you. Like, do you need to study for 17 hours or do you need to take a break? Listen to what you need to do. Don't listen to everybody else. So I try to spend time with my kids when they're here. My kids are super busy with their sports, but I think if you can manage to work not 7 days a week and still maintain a good life, I think that's important to do. I don't know. I think I answered the question, but it's a more complicated question. But this is an overview, like trying to focus on a big picture, not like I got to buy a car and I buy a practice and I have to do all these things and then miss the other part of your life, like your kids and your family or your boyfriend or your parents. That's can't take the money to the grave. So just focus on the big picture.
Thank you. So like the wrap question, like, are there any few tips that you want to give to the pre-dental students?
Sorry?
Do you have any tips that you can give us, like the pre-dental students?
Yeah. Tips in terms of like applying or tips in terms of what to do in the meantime, or what do you mean?
Just like applying or like in general, like if you have like 1 or 2 tips that you just want to.
Yeah, I really believe, as I said, and it's funny because the future DMD that was part of, I was telling Bruce, I was like, it's really important. I know we're talking about dentistry, but it's really the more important part is because, as I said, I can teach you how to be a dentist tomorrow. It's going to take a couple months, but what you cannot learn is communication, clear communication, and customer service. You cannot learn that in dentistry. So if you can surround yourself with people or opportunities where you get to do that, you get to learn, because, I've taken actually a few communication classes where they talk about open-ended questions. And I know it sounds boring when you're young. You're like, well, I don't want to listen to that. I totally know. I'm just going to, I know what I'm doing. I would actually, you'd be surprised. So if you create opportunities or have places where you can take courses on communication or even business and make network of people, and just really don't be this person who's like an A type who wants to get an A and gets dental school and I'm going to be a dentist. Like focus on other things besides dentistry. You're not in dentistry. You don't want that to define you. Like you want to do other things. You want to communicate in the proper manner to your employee. You want to know how to give constructive criticism. You want to, reading books. There's a lot of books out there. If you guys want to do audiobook, or, some people still like reading real books or the actual books on communication and how to be a good business person. Those are all great things that you can do in the spare time. Those are the things you will never learn in dental school. And those are good skills to have for life, not just to go into dental school. Some interviews are not going to be to do anything about dentistry. They're going to talk about, like my interview at UBC was an MMI, which is mini stations where you stand outside the room, you read a question, it talks about some weird topic, and you have to go in the room, you have to talk about your response for 6 minutes. You cannot look at the person, you cannot ask any questions, and then you leave and they mark you. You don't even know what you did. And how do you improve? So I think they look at your demeanor. How do you communicate? Are you clear? Do you have eye contact? Can you express yourself? Those are the things you cannot learn in dental school. Those are the things you need to learn in customer service jobs, when you go to courses, when you talk to people, when you gather for lectures. Like, those are the things that are really important, and they will carry you through whatever career you're going to have, whether you're going to be a dentist or you're not. So I think that for me, that is the biggest thing that I've learned. Because when I was at a dental hygiene, when I was a dental hygienist, our boss was part of this place. It's called Crown Council in the States, and they teach communication. And that was the first time I've ever was like, oh, this is how you talk to the person. This is how you ask the patient what they want. You don't want to sit the patient down and be like, actually, you have a crown, you have a filling, you need a crown, and you need this other thing. So any questions? That's not what the person wants to hear. The person wants to hear explanation. Some people don't want to hear explanation. Some people want to hear explanation. You need to find that out, because if you just sit there and talk at the person, guess what they're going to do? They're going to go out, they're going to go to Google review and say, oh, Dr. Mota was the worst dentist. She didn't ask me any questions. She just said, these are all the things you need to do. I think she's lying. Da, da, da. So really important to know how to approach each person, how to read body language, how to communicate is, I think, is the biggest thing. I hope that makes sense.
Thank you so much for being here with us.
No problem. I'm so happy I did it under an hour.
And being so helpful and giving the tips about communication, because that's something new I've heard.
Awesome. Yeah, I know. I know you guys, it sounds boring. You're like, what communication? I know how to do it. Trust me, the whole like texting and thing, when the person's sitting in front of you, and this is the other thing you have to remember, when the person sits in front of you, there's no texting. You have to look at them in the face and talk to them. And a lot of new generations are used to texting or used to like communicating over phone, and they have no skills. And I've had this in my school, like people couldn't talk to the patient. They were scared to call the patient for an appointment. They were like, I can't do it. I can't. What if they pick up the phone? So those are the things you're going to have to do when you're in dental school or other jobs. You have to do that, and you can't just be like, I'm just going to text you. So the more you learn, the better.
Thank you. Thank you so much for being live with us today.
No problem. Thanks, guys. Good luck, everybody. And thank you for listening to my little presentation.